of NCDs and here we have familiar faces, familiar people. We've been working with you for 4 years. And now we are summarizing the extensive amount of work. And now I pass the floor for a welcome address to Dr. Martin Weber, who is Program Manager for Child and Adolescent Health and Development from WHO Regional Office from Europe. In Copenhagen, this is the European WHO office.
Good morning, everybody. It's a great pleasure to be here with you to see the progress which we have made over the last few years in this school health project. I'm going to show you a few slides afterwards to give you an impression of where we are overall in the European region and globally. But for Ukraine, it was really nice to see how about 4 years ago, when the discussion started on the NCD project, with your input, we convinced the donor agency that actually school health is a very important component of NCD prevention and, of course, of health and well-being of children overall. There's a famous saying which says, it all starts in adolescence. And that's why we are here, because it all starts in adolescence. If you don't start your habits which are influencing your later life during this period of time, chances are that you will never start it afterwards. So you have worked systematically through a lot of the issues, and you have been the pilot schools to move this forward. So as an outcome of today, we would actually like to compile the lessons learned from your side and then have recommendations how to move it forward for the benefit of children in Ukraine. Suffice it at this for the time being. I think we can do a further introduction.
Доброго дня.
Good morning. I'm not Yuri Kononenko. I am Oksana Kovalenko, the Ministry of Education, Directorate of General Secondary and Preschool Education. Unfortunately, Mr. Kononenko didn't manage to attend this very important conference today because we have a lot of international activities. And we, unfortunately, cannot be present everywhere at once, but understanding significance, importance of this conference, our managers wanted representatives of the Ministry of Education to be present there. Why this conference is so important for us? It is important because these issues that we are going to discuss today and that will be discussed in the course of further discussion, this is something that is now a challenge to our nation. Our children actually move very little, and we know about that. Our children also pay a lot of attention or allocate a lot of time for such leisure as playing computer games, browsing the internet, instead of playing outside, playing active games. So they rather play computer games. As a result, now we observe cardiovascular diseases, and children are prone to obesity, which impacts their health in further life. And so we need to very much focus on these issues. Speaking about schools, you know very well that there are compulsory 3 years of physical culture, physical exercises, athletics, so that children could play active games and learn some active skills. For primary school, every 15 minutes they do physical exercise during lessons because children need to somehow release their energy. This is stipulated in our regulations. However, that is a problem not only for Ukraine, I guess. That is a problem, a global issue. So we do need to hear our colleagues who have already worked on that issue. Maybe they have their own approaches, ways to address that. And sure, we should suggest what can be used in our educational facilities.
Just a few words for Martin Weber in English. Thank you very much for your great help in organizing this conference. It's really very important for us. And I think that we will do our best to fulfill all these tasks which will be standing before Ukraine, before Ukrainian nation, and before Ukrainian school. Thanks again from the Ministry of Education and Science of Ukraine.
Я думаю, що дуже вам дякую.
Thank you so much, Oksana.
У мене не було проблем з дуже короткому спілкуванні,
And
тому що ви знаєте і українську,
you know,
і чудово англійську.
Ukrainian and English,
Ви настільки швидко це
and you were very prompt, quick presenting the material, so thank you for coming. We also planned meeting Svetlana Fitseva, who was actually actively engaged into the project, but now she's in Minsk, where they have a conference on school health at schools by UNESCO, and she is delegated to represent Ukraine there today. Unfortunately, she did not manage to join us here, but she is with us, virtually speaking, and she invested a lot of energy into this work. And now the floor goes to Mr. Martin Weber. And this is going to be the key presentation, European approaches to health at school.
Thank you very much for a kind introduction. I'm going to move over here to the side that I can see you a little bit better. And I'm not going to stand in your way because I want to make sure that you can see everything. It's always the privilege for people from WHO Regional Office to give the overarching perspective, and I want to give you a little bit of this insight, what's happening outside Ukraine at the European and global level with regards to school health. To deal with the health of children, the European WHO office has put together about 6 years ago a European strategy for child and adolescent health. And this strategy was adopted by all the ministers of health, our governing body, for the period up to 2020. At the moment, we are putting a new strategy together. And in this context, school health fits very nicely because the strategy says it wants to enable children and adolescents in the European region to realize their full potential to health, development, and well-being. What a better place to start with this than schools. There are priorities in this strategy, and I've highlighted here in red areas where school and the education sector play a particularly important role. It's supporting early childhood and adolescent development, supporting growth, and reduce exposure to violence. And when we come to the older adolescents, and we will hear a presentation today about the health behavior of school-aged children, it is the targets of NCD prevention which become very prominent, achieving a tobacco-free generation, promoting healthy nutrition and physical activity, tackling mental health issues, and protecting children from environmental risks. The overarching framework, which was passed just 4 years ago by the United Nations, and you have seen a lot of this before, are the Sustainable Development Goals, with 2 particular goals which come together here, again highlighted in red. This is health and education. So with these goals, we have a good international guidance to move us. And there is one particular goal there with target number 4, where we have a lot of indicators being put down for education. You have all these slides available for yourselves. We make them available to you so you can actually use them and reuse them if you want. Several of these indicators which are mentioned down here, and I'm not going to run through them for the sake of time in detail, are indicators which you have taken up in the context of your school health project. Moving back to the European region, we had a very important conference in Paris, which was bringing together health and education sectors. It was a high-level meeting, so high-level civil servants from the Ministries of Health and Education came together, and they came together to pass this Declaration of Paris, which we can actually refer to. And to sum it up, you have the text here highlighted, which is important in our context. But in brief, the main statement which was coming from this Congress is every school should be a health-promoting school. You are the forerunners here. You have piloted the approach for Ukraine, and with this mission, we can go away at the end of our meeting today and say, let's make every school in Ukraine a health-promoting school. How far are we with the introduction of health-promoting schools in the European region? The strategy, which I've showed you earlier, is monitored. WHO is tasked by the member states to report on progress against this strategy. So we sent out a questionnaire to member states 2 years ago, and we asked them as one of the questions, do you have a national strategy on health-promoting schools? And you can see in this graph of Europe, the countries which are in green said, yes, we have a strategy on health-promoting schools. The countries which are in red, including your country, Ukraine, where we are, said we don't have a strategy on it, and some countries did not answer. So you see there is some way to go to make sure that every country has a strategy on this, because if you don't have a strategy, you don't have a roadmap which way to go, and a strategy is important in a sector like this to bring together the several stakeholders. Bringing health and education together is sometimes difficult in the UN system as well. We have several UN agencies, and we have just heard from Oksana. There's a parallel meeting in Minsk organized by UNESCO. So our partner UN agency dealing with education is having a meeting on school health, and we are having one on school health in parallel. But I want to show you, sometimes we can come together. So we had a joint initiative with UNESCO, and that resulted in the creation of a UNESCO chair last year. A UNESCO chair is the same thing what we call a WHO collaborating center. So they are helping the agency to implement what's ongoing. So this UNESCO chair and the WHO collaborating center is based in France, in the University of Clermont-Auvergne, in the center of France, and they are moving on this initiative to make every school a health-promoting school. So, to move on, school health in Europe. This is a statement which I think is, in German we say, carrying owls to Athens. The English say carrying coals to Newcastle, carrying something to a place where it's not really needed. So you all know this already, that schools play an important role in health promotion. This is the statement on our website. Healthy environment and policies are the setting for it. Schools are setting examples and habits in terms of environmental health, hygiene, water, sanitation, nutrition, exercise. They are teaching life skills and health literacy, provide access to counseling and services, and of course, they need to link up with the wider community. And here I want to mention, we have another initiative which is called the Healthy Cities Initiative. The mayors need to make sure that city planning promotes a healthy environment. To achieve this, we are promoting the whole school approach, and I've seen with pleasure in the background materials that you have taken this approach, you have done the assessment, and you have promoted it in the same way with moving into the policies. What is supporting us in this endeavor in the European region? We have a network which is called Schools for Health in Europe, and this is a network which actually has been very active for over 20 years, and I know Ukraine was an active member in the past, but over the last few years it has not been a very active member anymore, and I think that's one of the outcomes of this meeting today again. I hope that you will rejoin as an active member the SHE network, which supports the activities of WHO, and as I said earlier, through us with UNESCO as well. It has got external support from several other European agencies like the Council of Europe and the European Commission, and it helps us in countries, in member states, to make schools health promoting. You have made good progress with a pilot project, and I just want to come with a country example how we move on afterwards. We had a similar approach in Kazakhstan 3 years ago with several pilot schools implementing the healthy school approach, and what I wanted to show you here, the government has fully bought into this, so not with support from outside agencies but with government funds. Now, Kazakhstan has just started last year, and my colleague Aygul Kutumratova, who is working in the European office as well, but happens to be Kazakh national by background, has been moving this thing forward very much to go up, and you see it on the right-hand side, to national scale. So by 2021, the government of Kazakhstan wants to have made every school a health-promoting school. So these are examples where we are well set as WHO to share experience between countries and to see how to move it forward. Headquarters, our colleagues in Geneva, are moving forward as well. So they are currently reviewing the global standards domains for health promoting schools, and you can see here this concerns school policies, the school physical environment, the school curriculum, and school-based and school-linked health services, including community involvement. The last sub-workshop today, and I just want to prepare the stage for this as well, is going to deal specifically with school health services, which is a particular problem, particularly in countries of the former Soviet Union, because you all had a particular model of school health services, and I've learned yesterday already that you are on the way of transforming them into a different way. School health services are a component of the overall school health approaches. They are an important part, but they are not the only part, and we will talk more about it later. If I try to sum up what sort of school health services have been the old school health services, these were largely relying on screening approaches. The school nurse was basically there to do endless screening examinations and document them in many, many, many books. But it was not very responsive to the needs of children. We have an approach to try to make all school health services adolescent-friendly. So the new model of school health services, which we try to promote in all countries of the region, is to provide services which the children need, which are easily accessible for the children, and they are more based on the individual response to a child and provide quality counseling rather than doing screening examinations to everybody the same, irrespective of the needs of a child. So this is another area we are going to talk about in the last part of our session this morning. I'm going to stop here. I just want to show you the last slide, which I owe to my colleague Jill Farrington from the NCD program, who is doing another parallel program today. So if you need to convince somebody why actually children should be included in NCD policies and discussions, here are 10 very good reasons. I don't want to walk you through because my time is up, as far as I know. So therefore, we are not going to go through this in detail, but you have these slides available. If you need to convince your colleagues, here are the reasons. Thank you very much.
Thank you so much. We will have Q&A session later. I believe these are very powerful messages for politicians, that's a great set of advocacy messages. Now I pass the floor to Tetiana Bondar, Ukrainian Institute for Social Research named after Yaremenko. And she's going to continue with the same topic. Thank you, Helena. I don't have a presentation, so your eyes will have some rest. And I'm going to introduce to you several data that are based on a research trial that was launched by WHO, HBSC research. This is health and behavior of youth at schools. It covers 49 countries in Europe and North America, and Ukraine is included into that database. And it is very nice that here we have the Ministry of Education that helps us to implement this research at schools, that you own this responsibility, and we already have some results that can be presented. There we have our reports, and if you are interested, you can look through detailed findings of this survey. That's the recent wave of the survey. It is held every 4 years, so we have good database to evaluate, estimate our work. Because we speak a lot about that, okay, children don't move a lot, they are not active enough, they prefer social media. We see that every 1 out of 8 adolescents have addiction, dependence on gadgets. But there are also positive figures that indicate that we are doing something useful. Because if we speak about adolescent health, we are speaking not only about schools, but also about health professionals, about parents, about kids themselves, all the organizations engaged. For example, there was a question, what do you do with your parents? And mostly they used to say, we have meals together, we watch TV, we do sports. But now 40% in 2002, it was only 4 or 5%. So now they do that, 40% of kids do that together with their parents. And this is about promotion of healthy lifestyle and active lifestyle. So gradually it is developing and people are engaged in physical activities. We organized focus group discussions, and once parents thought that they could just buy, that it was too expensive to buy admission for a sports club for children, but it is not too expensive to pay for gadgets, even though a price of a good gadget is like 8 years of attending swimming sessions. And also we see that children believe that their health status is not that good, especially for girls aged 15. Well, we know they are prone to fasting, to be unhappy with their body. We had those questions to them, and of course girls, even if her weight is okay, she believes that maybe she's plump, too fat for her age, maybe she needs to change something. So quite a lot of girls are very much concerned about that, and they see their health as poor health as well as their appearance. And of course, there are some indicators for BMI and what is too high based on height and weight. So quite a lot of children, and mostly girls, they were so depressed. There were moments, periods of time where they were depressed, they didn't want to do anything, and that tells us a lot about mental state of girls in that age category. Well, you could see also direct correlation with addiction. Again, for girls aged 15, they have the addiction to their cell phones, to their gadgets. Even the photos that they post, these are not the photos that show them as they are. Rather, these are pictures of what they want to be. That distorts the reality and impacts the psychological status of adolescents. Speaking about physical activity, I mentioned that is going up in the family context and at school, because now there is compulsory athletics, but we also ask them about their activity in general, if you do anything else. And the highest indicators are for children aged 10 to 12. Somehow they are more active, but then it goes down. 15, 17, it goes down. But if we consider dependence on computer games and TV, there the trend is vice versa, it's growing. I would also like to say a couple of words about tobacco smoking. Based on the research, we see a reducing share of those who smoke on the daily basis. And this is significant. I mean, it is not from 80 to 20, but I believe that 5%, that's also quite convincing, because year by year it goes down, and it means that our programs, the work that we do, that's sufficient to reduce the level of tobacco smoking, and there is an increasing number of those who have never tried smoking even. And, well, so if we do not recognize something, children start looking for this experience. And we see now that fewer children start their sexual life at the age of 15 or even 18. They understand that this can be delayed, because we speak openly now about that, about sexual life, and children become more aware, and they start later. This is also to a great extent due to the work that they do at school. I mentioned addictions. And also, every 1 out of 6 mentioned that they go to bed too late, even if on the next day they need to go to school. And also 1 out of 6 lies to their parents and spend a lot of time on the internet. So 1 out of 6 tries to find ways to hide that fact from their parents. So I believe that we need to use these findings now. You're welcome to take the reports, to look through that. We disseminate that to all the regional education departments. 2 weeks ago, there was presentation of the national report. After some time, there will be presentation of the international report, and we will see where we are in the context of European countries, if we are in line with certain indicators. But I believe that we've picked up the right way, the right approach, and the emphasis, the conference, that statements in our discussion proves that we are working in the right direction.
Thank you very much, Ms. Bonder. This is very interesting message, and right now I would like to give the floor, and I would like to remind you that right now we have first panel section. This is health of school age children and whole of school approach for effective NCD prevention and health promotion. We are talking about different policies, about general things. Right now, I would like to give the floor to Galina Dmitriev. She is our coordinator from Ivano-Frankivsk region. We had 7 of them. I cannot say that somebody was worse, somebody was better, but I really love you for your so positive and so active person. And thank you very much that you can really just get people together. Good morning. Thank you very much. I think that we have very mutual feelings toward each other, maybe because since 2002 we started to work together on health of children, but I don't agree that our children are our future. They are our present because they live here and now, and then the life in health of children is really very important. And talking about policies, really, I just restated my message. Yesterday we had very fruitful discussions, and Martin's presentation really made me think that we still have a lot of things to do. And when we are talking about certain policies and regulations and about our legislation regarding the education sector, it really makes me to rethink different activities and action that we shall take. Like when I'm talking about us, it's like mean adults, and when we try and educate people and we try to make health a very important value for them, this is not something new. But actually each new project gives us new opportunities. And of course, for us, it's not very common when we started to take part in the project. It was to develop the whole school approach. For Ukrainian education sector, this is not something very common. And when we learn the world international practice, we try to adjust them to our environment. And right now, the education process, this is much wider just than education. We're talking about education, training, and development of personalities. And we use partnership pedagogy for that. And we also change our this standard triangle: school, family, and right now we also involve communities and businesses to this process. So that's why of the matrix, so there's like 2 triangles. The center part, the key figure is our like children, and the educational institutions also shall provide the safe and convenient environment at all the levels. When we're talking about physical environment, moral environment, social environment, when we are talking about the relationship between children and parents, children and teachers, child relationship. We're talking a lot about bullying right now. And there are really good practices, and Dr. Weber also gave examples. We also have our school network for health promotion in Ukraine. We have very good experiences for implementation of programs peer-to-peer. And when somebody said, "Oh, we had a good program, but we have this program right now, and we use this opportunity teachers. We have a very good and just very valuable experience, and we have to revive it. And the information that is very important for teenagers, for adolescents, that is understandable for them and acceptable for them. This information we can use just to develop these voluntarily movements. And of course, today we talk also about the family's needs. And sometimes we want our children at school, they behave in the same mode, but they don't know how to do that. And when the child starts going to school with certain values, because when this child was 3 years old, her parents, his or her parents, just offered them kind of children champagne, but this is the tradition of the family. So I think that it's very important for us to show our own personal examples of teachers or parents. Yesterday I heard a very nice statement when one colleague told me, so my father just quit smoking when I was born. Do we have a lot of parents that are ready to quit smoking when a child is born? And thank you very much for your attention. Thank you very much, Ms. Dmitriev. And right now we have very short discussions, and we have right now 10 minutes for discussion. And right now, actually, we have some issues we would like to address, but please be very short. I know you're teachers, you like talking a lot, we know it, but please try to be very brief. First, which obstacles do we have in implementing whole of school approach? Which obstacles do we have, like barriers? Please, dear educators, if you have any ideas, just share them. Some of them we already mentioned. Olena Shiyan, Lviv region, the head of Life Competences Department. The obstacles. Yesterday we were talking about policies and regulations that can be implemented in the healthcare. First of all, the level of literacy, a level of just receiving information by teachers and directors regarding this program. If I do not know about this program, how I can promote it? We shall talk about health index and other characteristics. And really we had this school network, health school network. It was very active, but I cannot say that right now we have this network in the way we would like to have it. But this index can motivate us really to renew this network. If they look at the problems in the schools, and so the health school is not the school that has swimming pools, but the schools is that promote the healthful environment, and I think that we shall work on it. Thank you. Since 2005 in Ukraine we have been introducing the new subject, the health foundations. In Poltava region we trained more than 800 teachers on interactive methods, but it was the policy in the state. Right now a lot of these trained teachers left, and this project was one more impetus that gave us opportunity to train the teacher, but it was also the pilot course regarding the obstacles. it's really necessary to develop the plans for us to be able to train teachers, and not only in the health area but in other areas and other subjects, to be able really to promote the prevention of NCD. And it's really very important to use them in our schools. Which challenges do we have? That maybe this subject like the foundations of health will disappear, but I really want to keep it because and right now here's when a child has these ideas, receives information, so they have really some knowledge on the health. And when we were presenting the results of the social researchers, mostly it's because of this subject, the foundations of school of health. Турбакова Юля, Рівне. I will talk on behalf of parents. And our children, right now, they go to school in the afternoon, like after 12. How we can really promote the health of children when the parents, when they leave for work in the morning, but the children, they go to school by 12, and they come back to 5 or 6 p.m. How we can really to promote the health if we cannot really control the children? And because when do you think that this is a real challenge just to implement the health school program? No, but for our school we can solve this problem because again the kids come back home at 5-6 and then they stay until midnight to do their homework. When we are talking about obstacles right now, we have, if you think that this is an obstacle, there's like so-called second shift in the school when they start their lessons at 12. We have to talk about it, but right now they are talking about the subject of school, the foundation of school of the health can disappear, and we're talking about the time schedule of their child lessons. Really, when they don't see their parents, they do talk to their parents. We're talking about this environment, the network at schools, and we have to revive it. But Ukraine doesn't have the strategy for it so far. Let's again come back to obstacles. I don't want to talk a lot about negative things, but when we're talking about these school subjects, foundations of health, so if it can disappear, but right now we do not even train the teachers for this subject. So who is going actually to teach children if we don't have the teachers and we don't train teachers? So right now it was removed from the list of subjects that are financed when we're talking about the subject of the so right now they don't train the and I think that there is a problem also the and what about our obstacles, other comments? Thank you very much. And I think that the Ministry of Education will mean microphone is not used. Microphone. The microphones are. What we're talking about right now, about the specialist, about the teachers training, we're talking about the trainings of teachers in the high higher educational institutions. When we are talking about high educational institutions, this is not about school. We are talking about the training teachers, in the higher educational institutions. I don't think that you have to answer this question, but I really think that we will address this issue to the Ministry of Education. Some other comments regarding obstacles. Yesterday, we had very nice picture for everybody. It was very nice situation when two ministries, the Ministry of Education and the Ministry of Health. I think it was a very nice picture for mass media. And we are talking that there is no this link, this bridge between them. But here with the project, in our pilot regions, we are able to create this link because between these two ministries. And my second question is the following: which measures shall be taken to enhance this collaboration between just doctors and teachers at the local and national level? Maybe you have some proposals or ideas or problems when we're talking about this cooperation between health and education, because we really need to have the plan regarding further development of this collaboration. I think that colleagues coordinators will agree with me that we shall have not only 3 pilot schools, but 9 or 16, and just to enhance this cooperation. It's not enough to provide information. When we had round tables, and this is also for all pilot institutions, that the level of consciousness, when we have certain regulations, when we have authorities, and when the head of non-pilot institution asks about the state, our colleagues, they know that they know where we're going to get the resources for it, like material resources, financial resources, or other one. This is very high level of understanding the issue. We have a lot of experience right now to be able to have this cooperation between the two ministries, between health and education. For them, it's really very important to have joint program, joint working plans. And we are talking about the subject basics of health. The Ministry of Health is really interested in taking part in development of new textbooks on health programs. So they are involved in this process. And we, as teachers, why this health promotion school, why they're not so active right now? It was an activity of the Ministry of Health, but all this program had to be implemented by the educators, and the Ministry of Health they gave this program to us, but we didn't take it. It shall be the cooperation, collaboration, but it shall be the level of also like regulations and legislations, and to create joint working groups, and so we will be able to do it together. Comments? It would be really great if we implemented the local health service at the school, and if we would be able to have just the document, the legal, the official document that would require from the school just to support this health level, it would be in effect, of course. Oksana Khacharga, Kharkiv, the pilot institution. I would like to talk about the cooperation at the local level. When we don't have a doctor at school, like full-time doctor, and it also very, it's kind of difficult to control them. So what we are doing, we involve the parents who are doctors, and we also have the graduates, and so the parents who are doctors, they take part in our programs.
Can I just make a comment? Do you need the headphones? Yeah. When I hear you talking about the involvement of a doctor, we are talking at the moment about education, health promotion. And I see a division between Eastern Europe and Western Europe on this. When somebody suggests in Western European countries that a nurse or a doctor could do health education, you get a strong pushback from education. They say, this is not their role. We are education. We are doing education. When it comes to service provision, and we will have a whole session afterwards on service provision, then of course it's a different field. And I think you need to have this discussion about the content, what is the part, the health message which needs to go into it, which is coming from the medical side, and the process, the education, which is something which is the education sector. And if I take sexuality education in Germany, which was introduced 50 years ago as compulsory part, there is no involvement of the medical sector in this anymore. This is totally education.
Дякую. Про наші різниці. Зараз останнє.
Think about our differences, and right now I'd like what we were talking about in the second half, that we need to continue our work on just to spread our experience. We had some pilot projects, and we have just to continue it, and we have to work a lot at the national level and to implement the policies. And especially to have this bridge, this link between the Ministry of Health and Ministry of Education, and just to have its very strong link, and it shall be our priority. And what shall we do to make health of school children as priority? Just one word, one idea, one sentence. What shall be done to make health the priority? Just to understand that this is the priority. What shall be done to have its priority? Just to overcome myths. To implement prevention education at preschool institutions as well, kindergartens. What other ideas, like to make health as priority? To work with parents. Yeah, I was waiting regarding the parents, to work with parents. What else? And the state mentality, the public mentality, public opinion regarding health, cooperation with mass media, intersectoral just cooperation. And yesterday it was mentioned that other ministries also started to be involved on this. This is a dream, but we think about it. What shall we do to health of children become priority? Just for teachers to show their personal examples to the children, and each administrator shall be able to join a team of very active people, and a desire of school administration to be involved in this. Yeah, we heard everything we were supposed to hear, the experience, teachers, all this environment that we created in this project, and you mentioned it. Thank you very much for very good discussion. And right now we will start our next panel discussion.
So now our second panel discussion. We still have someone to join us. You see the agenda. Let me just say that at this session we are going to speak about health as space of health, the role of school health policies for NCD prevention and health promotion. Our key speaker is Irina Skarbon, representative of NGO Women Health and Family Planning, and she has 10 minutes for that. Thank you, Stanislav Vasilyevich. Please show my presentation, second presentation on the screen. And I'm very excited. It is so nice to be here today because actually it is, I don't want to say that this is our last meeting, but this is definitely a summary session. Today we are summarizing, we see the results, the outcomes, we look back how it started over the 3 years of our collaboration. Most of you here were engaged, and it is so nice. It is a great honor for me. It was a great honor to manage the educational component of that large project. So now I would like to introduce our key achievements, and of course I will try and show how it impacted policies of educational facilities that were engaged in the project. So, all of you in your folders, you have this brief note publication where we present the main achievements of the project. We described all the instruments that we developed, but since today we are also speaking about policies, let me mention that all achievements of the project, everything we did and planned and where we were heading to, we grounded on two key strategic documents that we now have in Ukraine. This is the strategy for the education reform, the new Ukrainian School, where it is about autonomy of the facilities, child-centered approach that gives more authority and more resources, but also more responsibility for educational facilities. So And Martin mentioned that we don't have a strategy, but I kind of disagree with that. We do hope that it is an overarching topic of our educational reform. That is an important achievement, I believe, and it gives us a lot of opportunities to move on. It's like a roadmap. And another national document, well, maybe it is not yet a reference book for all educators, but this is the National Action Plan for NCDs to achieve SDGs. And we are also very grateful to the project and to the WHO for supporting Ukraine in developing that plan. For that, this document was approved. We have it in our folders, you can see that. And there are a lot of items that can be and must be kind of promoted by the Ministry of Education and us, the community of educators. So we can already be guided by those two documents as key policies to develop the education policy. Going back to the model of healthy school, what was done by the project didn't appear from out of nothing. We very much appreciate achievements of our predecessors. Sure, we need to take into account everything that was done in Ukraine before that. Those were experiments regarding health, schools of health, and the safe school initiatives, international best practices suggested by UNESCO, CDC. Our main task was actually to try and show case and to prove that it is evidence-based, that the general school approach where all educational administrations and facilities work together, where they are linked together, where they do not fragment, do not silo their activities, that this kind of collaboration results in positive effect and better children's health. So today, at this section, we are going to speak about nutrition and about how we could develop this collaboration at school. We are going to speak about policies, and I hope that the examples that we will hear from our pilot facilities, that they will prove this, that it is much more efficient to work together and how to organize this collaboration at the facility level. This is what we are going to speak about now. The health index, school health index, this is one of my favorite outcomes. And probably today you will see the short description of this methodology. I mentioned it many times that initially at the beginning of the project we were looking for an instrument, a tool that will make it possible for us to measure what we had and what we have. But then we did the analysis, we studied a lot of various instruments, and we thought that it was a perfect tool that we should use further. And we adapted it to needs of our schools. And thanks to those colleagues who joined the process and who made their contribution. So why school health index and why in this project? Because it covers the key topics for prevention of NCDs that may cause the risk of development of NCDs. This is physical activities, nutrition, tobacco, alcohol, respiratory disorders, sexual health. Because its structure helps us a lot. It helps us to monitor and analyze how each of the components, each of the 8 models works. Because the very process of this assessment or self-assessment, it is so participatory that if you do everything correctly, you can hardly ignore this aspect of collaboration and development of close links with all sectors of school community. Because when we discuss each module, we invite everybody who are all the stakeholders. So if we speak about the medical school, we invite not only the nurse, but also parents, school principal, community representatives, cooks and security guys. So we engage all the staff, all the team of the school, and that is something that produces very positive results. Because everybody who is at school from morning to night, they may have their own ideas on how to improve the situation. And the most important thing is that if he or she is engaged into policy making, they will stick with those policies. Because otherwise the director may develop the best plan or strategy, but if they do that in an exclusive way, not inclusively, these plans will never be supported. They never will be relevant for students, for parents, and for teachers. So we believe that this instrument is very useful, and we would recommend disseminating it and rolling it out much wider than our pilot facilities. The second very important outcome of the project, it was a response to the question of how this topic of health prevention of NCDs, well, if we understand that that is an overarching topic, how to teach, how to convey the knowledge, the skills to everyone who works in educational facilities, not only for the basics of health teachers, because initially the teacher was delegated to be responsible. It was like a focal point, but he was seen as the only one responsible for all the ideas and duties, and the nurse, of course. However, to somehow change the situation, to engage everyone who is included into that model, into that circle, with your support, we developed an extensive training package for educators, capacity building of pilot school schemes, and you see this document, you will receive it today, it is freshly published, brand new. That's a very good tool, instrument. It is quite a large one, but it was a problem for us to eliminate, to get rid of some sections, because we did our best, otherwise we would have 2 volumes. So do use it, be healthy, and make your facilities healthier. In this training program for educators, in this manual, we cover NCD risk factors, assessment criteria, how to quickly focus on those children who need most attention, most consideration. There's questionnaires for activity, for safety, for interaction with parents, and of course support for children with chronic diseases, and this is something that we are going to discuss at session 3. And also these are our posters. You also have their small copies in your folders. You know that the original format is quite large, they are bright, and we've disseminated them to schools. So use that. Healthy sleeping pattern, this is also something that we should convey to children and parents. Activity, 60 minutes a day of active exercise, healthy nutrition. Hopefully it is now in the canteens of all the schools, and hopefully it is changing eating habits, and of course the well-being, good moods, which is a guarantee of good health. So this is briefly our summary. All the materials and outputs of the project are available. Do use those. But we don't say goodbye. We hope that all of that will be raised to a new level. It will be disseminated at the national level. Your facilities are pioneers, and you will be the role models, and other facilities will rely on your example. Thank you. Thank you. And maybe you should show this one, and maybe a couple of words about that. That's going to be the topic of our next discussion.
Мікрофон, будь ласка.
Previously, we mentioned collaboration, right? Okay, so now I pass the floor to Oleg Shevchun, director of Krasnograd multi-profile Lyceum from Kharkiv region, and he's going to speak about school health index. Good morning, Oleg Shevchun, Krasnograd Lyceum, Kharkiv region. We are the foundational facility for the region, so we have this unique combination of rural communities, urban communities, and hence the advantages and disadvantages of our facility. We have been the school that supports health and healthy habits since 2002. And this is the opportunity for us to bring back, to re-establish this network. So now about school health index. For us, this is a detailed instrument to analyze the situation regarding children's health. This is about the opportunity to discover local problems, to come up with a plan to get rid of the problems, to improve the global situation regarding school health. For 2 years, first in 2017 in January and this year in April, May, we have been holding this internal in-house surveys. Well, 2 years, that's not that much, but at the same time, that's a significant period. A school, it is static, but it is also a changing system. So it seemed to me that we had assessment or evaluation for 2 different schools. And that's why I now have this suggestion that we conduct the survey on a regular basis with a certain frequency. We should have it as a regular activity so that we could track all of these processes. What we managed to do over the time, over the 2 years, well, first, engagement in this international project, that is a significant impact factor for local authorities. Because we participate in the international project due to application of school health index, we managed to conduct school modernization. That was a significant problem because, well, of course, we need to upgrade, to repair the school, and we partially built, partially repaired the new educational space to contribute into exercise. For example, 2 gyms, and where children go out of school, you can be sure that they go outside not to smoke, but to play and to develop. And also, we visited the festival in Slovak Republic, and there, for health policy in schools, we were the winners. We were number 1. This is due to our children. And also, we significantly improved social and psychological and health services. We have a nurse for nutrition, for diet, Now we have implemented inclusive approach. Due to all of these processes, we work with international foundations and organizations, in particular for inclusive approach, that is GIZ. They are our mentor organization. When we encountered the problem of cyberbullying, we found Basket Foundation, which helped us to develop the tools to address that. But what is most important is motivation of children for a healthy lifestyle, because children, they convey the values, and if we teach them values, they convey that to their parents, and they also ground on that in the future. So school health index, that is an important tool for reflection and for comprehensive approach to address the issues that at school. The next speaker is a winner of the contest of Teacher of the Year in Poltava region. We held this competition. It's a pity that the representative of our ministry is not here. I should comment on that because initially 16,000 teachers of basics of health were engaged. However, we discovered that methodological training of teachers is good, but for content, they lack content. For example, implementing the school health index, that's quite a challenge. You need to very well understand what you are doing there. So I just wanted to mention that for 25 years, we have been developing this health basics of health subject, and we have achieved a lot. The results of this contest, of this competition, prove that, well, maybe you've seen their presentations, our teachers' presentations on the website of the Ministry of Health, and this is one of the teachers. So she was number 5, I believe, or 10. Well, it doesn't matter. Anyway, this is number 1 she is number 1 in Poltava region. Good morning, dear colleagues. For me, it is a great honor to talk to this audience that is very much motivated for health, for teaching children, and for changing the world. I believe that we don't have strangers here. So here, I am here as a teacher of basics of health, as a subject that makes it possible to integrate health-related knowledge, safety skills into a system, a framework that makes it possible for children to use those skills and to convey the message further. Because children are agents of change. They bring values to their families, they change people around them. I'm also a mother of 2 school children, and I am the deputy principal for education. So the aspects of health at school are so relevant for me. So based on the experience of implementing health index, I can tell you that children are changing. Children have changed their mindset, their attitude, and the school has changed. We see different relationships in the faculty, in the team, because where it's not only the principal who makes the decision, but the team makes the decision, where everybody is heard, there people are more ready and inspired to support implementation of these ideas. We were listening not only to teachers and health workers, but also also we invited parents and children, because children have a different perspective at school. So it's important to engage them into the evaluation process. We have succeeded in a number of areas. For me, it was quite unexpected that communities were very actively engaged in development of schools, because children are very important components of the communities, and that's very important for local authorities, for every member of the community. So communities were ready to allocate funds for gyms, playgrounds, for safety of children, for green classes, and a number of other things as positive aspects that I could mention. There were also a number of drawbacks. For example, it is very difficult for teachers to teach children to be healthy where they don't comply with those principles. Most children were ready to change their habits, but they still have these rooted habits. And it's difficult to teach health to children, good nutrition, physical activity, where they don't have that at school, at home, where their parents are overweight. You can see that they have bad nutrition habits in the family. But again, we hope that children are agents of change. When they come home, when they explain how it could be otherwise, parents are ready to change their habits. Thank you for your attention. And the next speaker is going to speak about nutrition. And this is the chef who has developed the best approach to school nutrition, and truly a professional. Yevhen Klopotenko. Thank you so much. Good morning, I'm Yevhen. Some of you know me, some of you don't. All of you know you, all of us know you. Okay. I'm just a modest person. My mother was a teacher, so I know how to be modest. So why I'm here? Actually, we touch upon a lot of important questions. Index of health, physical activity. We need to train teachers as well. We need to change the system. And you mentioned that you changed everything, but you didn't mention nutrition. And I was thinking about canteens. So I'm sure that this problem exists in all schools, because building a playground, that's one thing. Training teachers, that's a greater challenge, but you can do that. But very few people know how to change nutrition. Neither the Ministry of Health or Education or Agrarian Policy and the sanitary service, none of them is responsible for nutrition. They control, they monitor, but there is no authority that can influence nutrition. What I started doing and what I did, well, I developed this reference book, and this is my invitation to think about changes. Actually, I could see that teachers were not ready for change because they have well-rooted habits as well as parents. So I developed my recommendations for the new society, for new mindset, for the new generations, for their mindset. So I mention use of spices. There is provision 1591 where you cannot use spices, because there they say, well, spices are prohibited, but what about cinnamon? Cinnamon is spices, but somehow you cannot use it or what? So our system is far not perfect. So where I introduced spices in canteens, they started saying that that's prohibited. And if you don't wish to implement changes, you always see a lot of obstacles. Well, I suggest that to beet root, you add sunflower seeds, celery, carcaday tea. This is what I add, but otherwise that's just ordinary products. This is new approach. But the message is a little bit different, because I refer to the the dishes in a new way. Minestrone, carbonese, falafel, and they say, why not in Ukrainian? I say, because Ukrainians don't know what Ukrainian food is. Because actually what I speak about, that is Ukrainian cuisine, but we are not familiar with that. The problem is that we don't have our national identity. We don't know what Ukrainians eat, borscht, vareniki, and okay. So, if we are able to introduce these recommendations for school use, children will know what minestrone, falafel is, and you also have the explanation of those dishes. 2 minutes before you invite children to the canteen, you just check. Well, today we have minestrone, bolognese. I don't know what that is, but I will explain it to you. Bolognese, this is just macaroni with tomato sauce. I'm sure that foreigners here don't know what the problem is because they know what the dishes are, but in Ukraine we are often ignorant there. That is why Ukraine was rated #1 by WHO for food or nutrition-related diseases. So when we introduce the new dishes, we make children interested. Masala tea, bolognese, that's interesting. When I started introducing this nutrition at different schools, kids started saying, this is adult food, this is tasty, that is interesting. So this is about psychological changes, because teachers and parents, they are not going to eat that at school because they eat sausage, they eat buckwheat. But when children graduate from school, they will not only be aware of goulash, but they will know what rucola, ricotta is, and after that they will introduce the changes, they will make their own change. This is the message, the idea of my publication, that I change the social approach, because I cannot change you, but we can change the attitude of children. And believe me, after a couple of years, you will have my publication in every canteen. The sooner you start, the easier it will be later. Now, in Ukraine, 1,500 canteens have already switched to that. I go to the Ministry of Education, to the Ministry of Health, I go to the Consumer Protection Service, and they say, actually, we don't mind that, but we want a paper, a document that makes it possible, that definitely says that we can use that. But let's opt for our health. Let us step back from that Soviet approach to nutrition. You can eat that, okay, but let your children have a chance to be introduced to something new, because it is modern world of nutrition. Have you cooked something for us? Something interesting? Okay, and now the next speaker is Irina Mikhailova. She is Deputy Director from Vinnytsia, Deputy Principal of Vinnytsia School. And maybe she will explain how they're introducing these new approaches to nutrition at school. Yes, definitely. So our facility promotes partnership policy. Everyone needs to do what they do best. If somebody can come up with this very comprehensive menu, we should only use that. Partnership, this is the key aspect for our facility. So speaking about new approaches to NCD prevention, we this year started implementing Healthy Town approach, and this is about 3 lanes. This is the lane of healthy nutrition. There we have our canteen on the ground floor, and most of the facilities are supposed to be there. Then modernization of school equipment. We started implementing the project there. We upgraded our equipment to cook healthy food. That was 1 million hryvnias. Then water. We realized that we need to cook with quality water. So for 2 years, we have been having that 9-step water treatment system. Children can drink that water, and we use it for cooking. In the canteen, there are a lot of master classes that we hold. We have master chef competitions. Chefs come to teach us cook wholesome food. In the corridors, it is very convenient to organize competitions, social advertising of what we do, posters. There is also culinary class where our teachers can attend master classes. Second floor, it is physical activity floor. This is the lane of healthy lifestyle. There we have sports and tourism equipment, the Olympic lane. Since 2014, it has been the best one in Ukraine. And there we promote sports and physical activity. That is the physical education room. 19 sports sections and clubs. That's not that much. We have an extensive number of children. So we started engaging representatives of sports schools as partners. We provide them with sports grounds and they teach our children. So at our school, physical exercises are held by trainers. There are 4 sports groups, football for girls and boys, volleyball, basketball, yoga for teachers and children, sports tourism. There are professionals coming to train them tourism and various martial arts. That creates some challenges for us and set some requirements. We are supposed to provide them with gyms, with the facilities, but on the other hand, that's about ensuring physical activity, what we cannot do ourselves because we have few athletics teachers. The third lane is a healthy space lane. We introduced a new project, and with our we have volunteers for first aid.
I won't be able to tell everything right now because we don't have time, but this international certificate is issued by the Red Cross organization, and your children, they really go through trainings, they receive certificates, and then they continue to train other children. And as for health and nutrition, we have cooperation with the medics from the Mother and Children Center, also from some clinics that work with teenagers and young people. We have also certain activities with involvement on children, parents, and teachers. And we also have pediatricians, OBGYNs in each class, and also for the parents, we have the gastroenterologists, dietitians, and we also involve the basics of health teacher. And they really help us to implement and just to develop these plans. And if we have for small kids and the primary schools, a lot of kids they are overweighted, but as for the 15, 16, the vice versa, the girls, they are very obsessed with their just health and how they look. And also it's very important when the parents not the parents but the children from the 1st and 11th grades, they, for example, they have joint breakfast, and the small kids, they know this plan in the very beginning. They have food quest, they have nutrition plate, and they also have sport classes. They have special nutrition for the sportsmen. For 45 minutes, they have this food quest. They get all these useful things, and then they go to the canteen. And so they have from primary school and from the secondary school, the children they eat together, and together when they have this healthy food plate, they started to eat together. And this is not only promote healthy nutrition, but also exclude the conflict situation in the school, because the older kids they never abuse the small ones. Thank you very much. And we still have 5 minutes. And as for coffee and tea, we also just we'll have coffee and tea. We'll still have some time for discussion. And right now we had very interesting discussion when the director and deputy director and the teacher for basic health are working together, because this teacher cannot implement certain activities by herself or himself. But when we also involve the director and the administration of school, it's a different story. Because, for example, like even to service and just to buy this filter, water filter, it takes money. Okay, we bought filter at the expense of certain financial like donors, but then the local council helps us to maintain this filter. And just some questions. We have two questions for discussion. The first one, how we can integrate the health issues to the school policy, how we can do that. Just some recommendations and advice, please, your ideas. Colleagues, I'm absolutely sure you have something to share. And there is a small comment. If you look at the new document as for the functions of the school director, if before it was said that the school director is responsible for health and knowledge of the children, but right now, director is not responsible kind of for the health of children, but it cannot be like that. Because when parents bring a child to school, the parents really hope to get the child healthy and alive back from school. So I think that one of the proposal is also like to reintroduce this director's responsibility for health and children, for health of the children. Tatiana Miroshnichenko, director of the private school from Ivano-Frankivsk. Really, health nutrition is very important issue, and the school's director shall really take care of it. And I would like to thank Mr. Klopotenko that he really developed these recipes, because when he found these recipes in internet, we really started to use your recipes, and the situation with the nutrition in school changed. And you're absolutely right, the children, they really like these very nice names, and this is the same beetroot, but it has jam or with some seeds or some other ingredients. This is very tasty, and this is a different story, and they like it. And we are a private school, and number of children, due to your new recipes, we have more children that want to have healthy nutrition, and they ask every day, what is that, what are we going to eat? And this is different culture of nutrition. Thank you for this conference, and I think that this option of these recipes, this book with recipes, shall be used in each school, and you will see the nutrition. Yeah, you will have to give 1% of your income to school. And due to the health index and due to the health index project, we have an opportunity to see our weaknesses and strengths and to set up our goals. And we are talking about partnership. And we are a very active school in the community, and this is the international standard partnership leadership joint project right now. Our city council, so they gave us independence in making decisions regarding nutrition. So if you want to change the menu, to change the nutrition, you can do that, because right now actually law allows us not to approve it and the state authorities. Before it was impossible, you know it. So right now we do not get any approvals. Besides of the pasta, we started to use bulgur. We amended menu, we amended recipes, and And local authorities told us, if you want to do that, do it. But they were not very loud about it. But we did it, we tried it, and we asked parents of our children. And the parents are the main consumers. The parents and children, main consumers of our services. So because of local authorities gave us this freedom and this opportunity, we did that. And right now, Department of Health and Department of Education, they also have joint projects. It's very important. And in Poltava, we have this partnership. We don't have time right now, but I think that you're hungry right now. It looks like you are hungry because everybody talks about food. And we have the subject basics of health, and we don't have one very clear opinion about that. Do you have any comments regarding the content of the subject, basics of health? We developed and published textbooks. We believe that it's nice, but maybe there's something wrong there. Just tell us. Because this is your work, and you work with it all the time. Why I asked this? We visited school number 58, number 16 in Poltava, and they have like householding subject. So they teach their children to cook, how to cook, and everything is organized as it shall be organized. Can we at the subject like basics of health, like for 1 hour during the week, just explain the kids about the health and nutrition at their homes, their families? Is it possible to do that? But we are talking that we give them skills, but we have only 1 hour per week for these skills. And maybe this is a nice content of this subject, but regarding the time for this, we don't have enough time. Our key issue is that all these projects, that health index, training program, manuals, information, how we can do it, just how we can promote it to other schools, how we can promote the field of our activity, which ideas to have. Shall it be nominated for some category, shall it be approved, or what shall we do with that? Irina Volkova, Kharkiv regions, on April 17th, by the decision of the Department of Education of Kharkiv State Administration in the best pilot educational education. So we had meeting with administration of different education institutions of Kharkiv regions, and we have this 44 education institutions, and Irina Skarbon also took part of this meeting, and we started in Kharkiv region the ongoing workshop, and it's also included in our plan, when we'll have motivate, train the representatives of administrations of our basic educational institutions. For example, they have like the several schools and different vocational schools, and as of today, the participants who took part in our roundtable, like 44 educational institutions, also they also have branches, and I asked to continue this project. Thank you. Yeah, first of all, our pilot schools shall be involved. First of all, it also shall be in online format, like health index, and we are talking about some institutional audit. It's also Poltava School number 24. This is my third time on such a meeting. We have been working for a long time with health issues, and all the schools of Poltava regions are ready to join this project, but we really ask to give us more materials, more information, and also like to provide teachers training. One more comment, because we are really out of time. And also the post-graduation programs. Right now we redo the program. There will be obligatory module, workshop for post-graduation education for teachers, for further trainings. And Svetlana Fisala is not with us. And our heads of the educational departments shall be kind of pushed, and this push can be generated by the Ministry of Education. Thank you very much. Right now, coffee break. We had very nice discussion. We can continue during the break. The challenge of coffee and cherry pie, but we shall start anyway. We don't have an opportunity just to wait longer to start our session. This panel discussion will be moderated by Martin Weber, and we were talking about the role of school health policies for NCD prevention and health promotion.
Yes, I've just taken 2 words between giving it back to you again. So we are coming now over to the long-awaited session on the school health worker, the school health services. I have shown you 2 slides at the beginning already about the role of school health services on the context of school health, and that the school health worker, the school health professional, has to fit into this. I said already there are very different models in different parts of Europe. And actually, just to tell you, some countries, including my own, never had a school nurse. So it is not that the school nurse or the school doctor is the most important part of health promotion, but WHO believes they have a very important role to play. So I'm looking forward to this session today to learn more about what you have been doing all together, and hand back with this to Galina Majstrok, who is giving the keynote speech about this.
Моя презентація, якщо є. Будь ласка, хто там з презентаціями? В мене є дуже мало часу.
I don't have a lot of time. I will try just to present everything within 5 minutes. For a long time, we have been living in the community when we know that we have nurse at school or health professionals. I graduated in 1976, and I know that there is a nurse in my school, and I know that all the injections shall be done through the nurse. If I have to leave and I want to leave the school, I have to come there just to tell that I have a headache, and I will be allowed to leave. And the nurse, she went all the time to the canteen, and she checked what was going there, and it was everything that she did, no all other competences. One more thing, they also weighted us, they also vaccination, injections, and today when we started this project, and we didn't start it from the scratch actually, we had a lot of initiatives before that. And all the time we discussed the status of school nurse. There is not such profession. For example, there is a nurse at the dentist, but there is no school nurse at the list of professions. Nevertheless, we had a very clear understanding that school nurse, they are from the children's polyclinics, children's hospital, they went to school, and they were just accountable to these children polyclinics. And 4 years ago, we thought that looking at this background, we were able really to approve the competences of the school nurse. We will develop the plan and we will follow the plan. But the real life was a little bit different. We found out that the school nurse doesn't fit this system of reform. So we didn't confirm the status of school nurse. We had a lot of ideas that it shall be the nurse of public health, but nobody knows what is public health and how we shall relate this nurse to the school. And last year, when we had the sessions at our 6 pilot institutions, the main question was from educators, like a person from the Ministry Department of Health came, so we had this person and it was good, but then We had a question. The Ministry of Health system didn't need it, but how we can relate it to school? And here we have a very unexpected situation when the school started to be responsible for the school nurse. What are the competences of school nurse? If school nurse doesn't do vaccinations, what shall be done? And here's the Ministry of Health tried to transfer these competences of school nurse to the educational institutions. Unfortunately, school nurse is treated as a technical personnel with very low salary, and within the project we try to do our best, at least to develop tools, visions, and to follow the different paths. So there is a school and there is a nurse, and we wanted to give it proper names based on the responsibilities of the nurse. Schools started to understand what will happen if there is no nurse or if there is no medical professionals, what happens if there are some urgent things. And after the vaccination experience, school really had a very serious role in that. So, school nurse can promote for the children just to stay healthy, and this is the main goal of the medical specialists at school. And we see it as the school medical function, and first of all this is prevention to maintain reproductive, actually sexual health, mental health, and to develop the health maintaining environment. And also we have inclusive program and just to maintain the children, and the competences of the school nurse. And WHO has standards, and we used the standards to create this project for the competences of school medical workers. And here you see that due to the fact that we are not sure if the school nurse will do the vaccination, but they have skill of effective communication, counseling, intersectoral and interagency collaboration. We understand that school nurse or school medical worker she will not be able to check all the children, or just to, for example, to have some lessons and trainings if you have like 1,600 children at school. But if it's necessary to involve the school nurse, the school nurse actually helps to solve the problems. In our pilot project, we have a very prestigious Kyiv school, and everybody wants there to be there. And a school nurse came to our lessons, and she said, "We don't have sick kids."
And she explained how they were dealing with a conflict regarding a child with diabetes 1, and this child had to make injections in the class, and children could observe that. They were appalled, terrified. There was no specific place for that, and there was this conflict. The principal had conflict with parents, and that is a leading Kyiv school. So it is important to not just to not create conflicts, but to address, to resolve conflicts. For that, we need efficient communication. So we are speaking about the European concept of standard approaches, standards. We started developing this concept 2 years ago, and it is well represented in the textbooks. We created a very good manual, and it is a complete, comprehensive set of materials on health improvement for health professionals. It can be used for training, for advanced training, professional development. It could be a curriculum or program developed together with the Ministry of Health and Lviv College of Postgraduate Education, and I believe my colleagues will mention that. But that's just the beginning of that work. These are initial steps to do that. And you will see all these publications there at the entrance. It is multicolored, it looks attractive, appealing, it is written in user-friendly language without too much specific terminology. It is the material that you can use in your work. So the testing, piloting was held in Lviv Medical College. Ms. Katerina Balabanova is going to speak about the approval of it and training of 9 medical colleges. We worked with the methodology centers. We were joined by great, motivated people, professionals, who now have new perspectives for this issue, for further development. So it took me 10 minutes, sorry. That was so fast. And now, I pass the floor to my colleagues.
Thanks very much, Karina. So we go over to Katerina Balobano.
Good morning, dear colleagues. Let me take 3 minutes for general overview, and then we will have a discussion with Galina. So, us, the Center for Nurses, we are an upgraded center, and now what we need in the healthcare system is actually to upgrade the staff, to reform the human resources. Because now we speak about problems for school nurses, but we have problems or issues for nurses in general. This is about labor conditions, workload, salary, quality of services. This is what affects patients, those who are recipients of the services, level of knowledge, education, and management. Management at all levels, this is rather for the authorities to address this issue, because leadership and management, it is something that needs to be further developed, and we don't pay due attention to that. Speaking about problems, particularly for school nurses, it is about lack of regulatory framework. It is not about being subordinated to the Ministry of Education or Health, but I mean, when the legislative framework was updated, it happened so that 5 years ago, when for general nurses in general, it was more or less okay, somehow school nurses were not covered, not included into attestation certification system. So now it is and there are a lot of questions about whether we need to go back to that certification system, or maybe we need a new form or modality for certification for quality control. And also another issue is that in many schools there is no dedicated vacancy for nurses, and sometimes you don't really, the principals cannot recruit nurses. So in the list of professions, it is probably necessary to introduce the particular speciality of school nurse. Maybe we should do that. It was not done 10 years ago, but now we are in the process of discussing that with the Ministry of Health, and our Center for Nurses and Public Health Center is engaged, and we work with Halina. We have a working group on that issue, and we are discussing who that's going to be, but definitely that's going to be a professional that is related to education, to school, and where school pays the salary, and we need to decide how to refer to that specialist. But starting so this year we already have some elaborations, drafts there. So the draft curricula, now nobody approves curricula. I just want to mention it to Halina. We can only recommend curricula. We pass them over to colleges, and colleges can use that at their discretion. But what we are suggesting to develop now, it is like an entry point for that profession, where they pass the test and get certification. There, they should be dedicated professionals, and principals should be in the position to expect certain skills and knowledge, and they could offer competitive salary to them. So this is what we're trying to do on our side, is to ensure the quality for nurses, for health professionals who work at school. Let that be a school nurse or public health nurse, whatever you call it. And again, this is about upgrading the system, and so we really need to step back and to ensure the transition to the new staff policy. Thank you.
Thank you very much for this introduction. I hand over right away to Irina Matvienko.
Thank you, dear colleagues. It's my pleasure to be here and to talk to you, to see my good friends, Martin, because with you, with them, we've done a lot in other areas of healthcare for children in Ukraine. Now, speaking about school medicine, me being a doctor, pediatrician, I see that issue from the standpoint of chronic pathologies of children who study at school. And we should not try and convince ourselves that there are few of such children. No, there are quite a lot of them, and their number is increasing. And we say that when a child with a chronic disease, this is diabetes, cardiovascular diseases, bronchial asthma, this is quite severe conditions, and they may result, they are life-threatening, they may be life-threatening unless the child is provided with timely aid care. So if the child attends a general school, the child, parents, doctor, and the health professionals, other health professionals at school, they should be sure that if anything happens, they are in the position to help the child. That means that nurses are supposed to have very significant information capacity and practical capacity, but she is a nurse. So what could be done there, and that's adequate, that's a normal approach. As Halina mentioned, a nurse is a communicator, well-aware communicator who knows how to act in this or that situation. There should be links with parents, with the child and the nurse, and also the teacher. The child who goes to school and who has a chronic disorder or condition needs to have kind of memo where it is indicated what needs to be done in case of certain situations that could be expected in case of this or that pathology. This memo is very straightforward. And by the way, I recommend this manual to you. this guideline. It was developed by, as Halina mentioned, it is developed in a very user-friendly way. There are forms for monitoring that are filled in by the child's doctor, and they are passed over to the nurse. And then the nurse communicates with the teacher, with the child, and if problems arise, they are in the position to properly respond in order to prevent complications or even fatal cases. And time is over, but let me mention one more thing. We cannot teach nurses everything. That's impossible. Communication, specific features of communication, how to explain, how to keep in touch. Well, here, this manual, it even contains training activities to help nurses to adequately communicate with the child if problems arise, to ensure trust and confidence, to make sure that the child feels safe at school, for parents to understand that child will be protected and will have access to care if needed, and that the nurse were not afraid of children with pathologies to avoid the situations as Halina mentioned. All of that is possible if we communicate properly. And again, this manual makes it possible to do that.
Thank you very much for this introduction. Let's go over right away, because we are running a little bit late, to the last talk by Lesia Wolf.
Дякую. Я там попрошу презентацію.
And I have my presentation there. Is it possible to speak in the microphone? Мікрофон, будь ласка, говори.
Я так голосно говорю, що я до мої привикла. Так, я зрозуміла, що перекладачі. Знаєте, я вам хочу сказати,
So, when talking to colleagues from other regions, I can hear that there are problems for continuous education of nurses. In Lviv, we don't have that problem because we have this joint order of the Department of Health and the Department of Education, and all school nurses undergo professional development, postgraduate education training courses. So, lifelong training, education is necessary, and we need to train our nurses who work at school, who need to know much more and to convey this information to young people. So we can see that the nurses who want to be trained, we see more and more such people motivated to continue their education. Here, on this pie diagram, you can see how many nurses are trained. Look, yellow, it is preschool education, nurses from preschool facilities, and blue, these are school nurses who annually attend the advanced training courses. Now, regarding the problems of postgraduate education, we discussed that today. Above all, that's about motivation. Nurses have very low salaries, and of course, they are not motivated to pursue lifelong training, and also the obsolete legislative framework. Maybe you will agree with me that attending this development advanced training once every 5 years, that's not very reasonable. Well, if you do not practice some skills for a year, you just forget, you lose that. And here we conducted a survey. We asked nurses, 46 school nurses, and the findings include the following. Well, we need to motivate nurses, but actually, when they come for training, they only expect to have the document, the certificate. I mean, they must come and they come. But Even when working in the framework of this project, we work not only within the school component, but we were actively engaged in the NCD component. Our teachers were trainers, and we managed to change approach to training. So now, if we are able to present the material in an interesting, innovative way, there is more motivation to study. So we had this curriculum. You can see the subjects included into this curriculum. But now we have updated that. We have introduced a lot of new subjects. That includes prevention of NCDs. And of course, we have a significant focus on infections control, as well as emergency care at pre-hospital stage and communication. These are the activities that we organize for school nurses. These are conferences. Here we participated in the NCD project. Our college hosted a lot of trainings. Lviv region was a pilot region, and we are the leaders there. And eventually we are grateful to charitable foundation Women's Health and Family Health, to Irina. Thank you for believing, trusting us. Thank you for engaging us for training activities, for the pilot training on the school component. We have held, teachers of our college were co-authors of this curriculum. We also piloted the curriculum. The nurses were very happy, and these are our trainers, Olena Nazarova, Oksana Puri. They held these trainings. And we realized that if we introduce modeling approaches, hands-on experience opportunities, there people will be much more engaged. This is a variety of trainings that we hold with nurses. You see, we have the training center. Here they measure blood glucose level. We can do that in different settings. This is our training for first aid. So this is what we do, different trends and master classes. I believe that you understand that if we invest even more into that, the situation will gradually change.
Well, thank you very much for these presentations. I think we got a very good overview now of the possibilities. And I must say, this is the most difficult area, because from the WHO side, we are looking at experiences in countries. The school nurse is supposed to be able to do everything. At the same time, she's not paid anything, and it's not clear where she belongs to health and education. And this is a problem many countries are struggling with. And you obviously, what we could hear, you struggle with the same thing, with the multiple roles which are coming in. Just to tell you, from Lithuania, where I was a few months ago, they had a Soviet system school nurse, which they abolished because they thought we don't need this, replaced it with a public health nurse who is non-clinical, totally non-clinical, only health promotion. And then they had inclusion, and then they thought we need clinical skills again. And they thought we should have a public health nurse with clinical skills, which does not exist. And nobody would be paying for somebody who has double graduation, clinical and public health. So the discussion goes on and on and on, and I think we could spend at least a day with this discussion. So having said this, I think we open the floor for your comments.
Your colleagues, your comments? A nurse at a healthcare facility, does it have do they have much higher salaries? This is the same status now. Why such a gap? There is a difference because now school nurses, that is a position that is funded by the Ministry of Education. So all of that is within this structure of the Ministry of Education. And it happens so that actually they are at school and they are regulated by the principal, but for the healthcare sector, there the situation is different. This is approved by or regulated by the hospital manager, etc. That's why, well, actually, you mentioned Lithuania. We also had this experience and we paid a lot of attention to Lithuania because it is a good example of transformation after the post-Soviet system. But they did that transformation in 1996. They adopted the law on licensing of clinicians and nurses, and then it went well. There were no professional requirements, there are some language requirements, etc. So we already have regulatory framework for licensing, and there the focus is on knowledge and skills for clinicians. But for nurses, we are still developing that, and we are lagging a little bit behind. So the problem is that they are subordinated to schools and to the education system. And with Galina, actually we work as enthusiasts because we cannot influence that, because that is the field of the Ministry of Education. But what was the sense of subordinating healthcare professionals to the Ministry of Education? Because hence the conflict, as mentioned by Galina. Well, this conflict is related to the fact that a nurse is subordinated to school principal. And that's why she says we don't have unhealthy children. But if she were a representative of the Ministry of Health, she would be more reasonable. Well, this is the system of funding. So it was there, it has always been there, funding aspect. But we could go back to what Lesa mentioned. In the Lviv region, they managed to ensure this lifelong training, advanced training, because otherwise the nurses try to avoid responsibility. She is apprehensive. But where it is done at the local level and it is funded from the regional budget, where they have money, right? You have the contract with local authorities. Well, that's not a problem. Nobody prevents you from doing that. We are in the process of decentralization reform. You can address that. That's not a problem, but we need to speak about that. Ms. Volkova, Kharkiv region. Let me tell you that positions of school nurses, well, which they just had to subordinate that to the Ministry of Education, because where a nurse comes to school from a district or regional hospital, then they may say, I will do this, or I will not do that. Like, not always they had to just beg hospital managers to appoint nurses for educational facilities. So it was just a necessary step. There was no other way out. And eventually, they decided to introduce the position of the school nurse into the structure of educational facilities, and it is funded at the local level. Here, with the decision of Lviv Regional Council, they introduced the vacancies of nurses for all schools in Kharkiv region.
But you say that their salaries depend on director. They come to us and they're specialists, and their official position is a specialist. So right now you mentioned several times that I am from education, but I have to take care of the school function since 2005, because I know I am a regional coordinator of health promotion network, and we are looking for legislative documents.
I wanted to say something.
Я з вашого дозволу продовжу думку.
Yeah, I would like to continue this thought. Kharkov school number 152. Really, the medical workers, we have their full time, and there are certain positive things in that, because when at our school we have lessons until 2:30, and after this we have different activities like sport activities, and the chief doctor of the hospital, they called for their medical workers. We have some meetings or we have some whatever, and just to tell the head doctor of the children's hospital, just to tell that right now we have to have this medical worker at our school because we have some competitions or other things. It was impossible to get this nurse to school. Right now, these medical workers, they are employed by school. They work with us. They support children. They are with the children. But still, we have the issues with salaries. Yes, we have a doctor right now, and we have a nurse, a school nurse, and this is only due to the director of the school who was able to find these people who agreed to school with their salary. Also, we're talking about the functions of the nurse and a doctor, because besides the analysis and other things, but like to look at the temperature.
Все на цьому
Thank you very much. It was just some responses. I would like to ask a question or to address the problem. At our branches, we have the branches in the rural areas, and our institution is in the city. And I have conflicts, not conflicts, but some issues with administration regarding the responsibilities for medical examinations of children after school vacations, like summer vacation. We have a school nurse. She is employed by the polyclinics and the rural children. They shall be checked by these rural medical functions. And this is a conflict all the time because they try to push this responsibility between each other. We can maybe solve this problem at a higher level.
I don't know whether you understand me if I'm talking here in English. You know what it tells me, the discussion is, there are no clear expectations, there is no clear job description, and it is obviously a problem which is partially addressed in your manual, which you obviously have looked into it as well. But I think when we are going up to the national scale and scaling up, there needs to be much more of a national dialogue to be clear. When people talk about medical examination of a school nurse, it reminds me very much of the Soviet system. This is clearly the screening examination, which nobody in Western Europe would have in place. You would not expect these sort of things to be in place, that a school nurse would need to do examination of all the school children on a regular basis, because that's the role of the health sector and not necessarily of the school sector. So I think this sort of national dialogue obviously needs to be happening, because you are getting now your experience from your pilot schools, but to take this up will be needed further. You wanted to add?
Well, українською.
I even made notes of your viewers. I will not comment right now because this is not the place for the discussion. This is very detailed things. I heard this position already. There are different systems, and these are two contradictory situations. One situation is with a nurse is employed by school, and you have a situation when this nurse is officially employed by the hospital. So there are like two different moments, and we work on it. Because I am a doctor, I have PhD, but I am a mother, and my children, they go to school. But I try to understand the philosophy. There are two moments, and we have to decide what is better. It may be really this public health nurse. Maybe it shall be this nurse with certain set of functions, because functions of this nurse is not this medical examination. This is not an examination. It shall be the source of knowledge. So this nurse shall provide knowledge, advice, recommendations, and regarding that, a lot of things depend on school director and the medicines and the healthcare. We've already started to implement it when started to change this when the director is responsible for everything. Yes, the director is responsible for certain things, but the legislation actually helps us also to implement certain things. If the legislation doesn't allow you to do that, like to provide the services in education and healthcare, we shall change. But otherwise, we have a lot of freedom right now. An example of my school, really, when a lot of things depend on director. Also, this parents community, teacher community, children community, as we have it right now. We have a trend in the new school, and yes, we can also add a medical worker. Just medical worker who will be able to take part in discussion and just share the recommendations. But this is the issue of leadership. But this is not about medical examination. And how do you train them? One more question. How do you train them? How do you improve their skills and qualification? They don't use microphones. And I would like to answer the question regarding training and education. Yes, we have a problem with understanding about the competences and the responsibilities, functions of this school nurse. I am from Lviv, and they say that everything is solved in Lviv, but I don't see any problems with improvement of the qualification and skills of these nurses, because any post-graduation institution, maybe I'm too bold to tell this, none of the post-graduation institution will not conduct these competition trainings. We have 12,000 teachers that we have to work with, and these nurses, they shall go like to the medical institutions. Okay, but who will pay for it? Who will pay for their trainings? They don't use microphones. Regarding the payment, who's going to pay for it?
тут за те, що до них прийшли, ні той заклад, де підвищують, теж не платить.
The schools do not pay for it. The training centers, they do not pay for it as well. Right now, they develop a new program. I am the head of the life competence department from the postgraduate institute. So right now, they develop this regulation that the money shall follow a person who shall be trained. So they will pay from the local budget or they will pay from the state budget. So these people who shall be retrained, and just to improve the qualification, this person has a right now just to choose the institutions or training courses. And I think that the nurses will not go to the educational systems, but they will go to healthcare, like the sector. The teachers will come to us, maybe they will go to the Red Cross institutions. But this nurse, she has to have this retaining for 5 years.
Thanks very much. I think we had a lot of discussions. Please take your headphones, otherwise you don't understand me, some of you at least. As I said, this is a very big issue. There's a lot of dialogue needed because in the end it is a standard which needs to be approved. You have to get people who want to do this work and somebody has to pay for it. This is clear, nothing is for free, and therefore if we want it, it has to be put into a system. You had some experience now with the current pilot project, which is obviously going to inform the discussion. We are running late. We need to get to the conclusion already. So please, a very short statement.
Yes. Два слова. Шановні колеги.
Dear colleagues, we have to understand everything. So there are problems that should be solved now and problems that can be solved tomorrow and in a couple of months. Today we have sick, not healthy children at our educational institutions. We have to solve this problem at least. And then further on, we will train the nurses. We have everything for it. But we have to develop a very clear plan and just to follow this plan. What cannot be solved now, we can solve in a month. But today, we have to start to solve our main problems, and we have tools for it so far.
Thank you very much.
No. Okay, yes, of course. Я просто хотела сказати по поводу безкоштовного.
And regarding free, Martin is like said it from different area. This education was never free of charge. Taxpayers pay for it. And also like we do it through the economy and like we have plans. But when this like right now we have money for particular patients like school children, and for these people who shall be retrained, we will understand where to get this money, how to use them. But right now you can do that. You can tell to your local council who actually give you the budget. You can tell them we need this amount of money for improvement of their skills and so on. And or I have to be retrained because I cannot be responsible like for this institution because I have a school nurse and I need it. I need money for it. You can do that, and you have to take upon responsibility for all these issues.
Thanks very much. I think we had a very fruitful and very vivid discussion, which will obviously continue. And I think we will need another workshop when we come to the scaling up, because there is a lot of regulatory backlog which is needed, all the expectations which are there. And then, of course, it needs to fit into the general framework. And you need to find somebody who is willing to work under these conditions. So with this, I hand over to Galina again. And we come to the conclusion.
Я вам дуже дякую за
Thank you very much for very fruitful discussion, and the main thing that we address the issues for this discussion, and we actually touched all these issues. And we were talking about focus on prevention block, prevention activities. And we talk about the school program, and this is also shall be like staff training, specialist training, and so on. We also talk a lot about these positions, these jobs, if it's like attractive or not. And we shall not be crying and tell that before that everything was perfect, we had perfect situation, and right now everything is so bad. No. But you complain that the hospitals and the polyclinics, they could call for their nurses anytime. Right now you have nurses, they are your people. And right now our help shall be focused on development of these competencies, improvement and training. Trap people, available people, you can look for these active people, just involve them and not wait for some comments from the top. And regarding your competences, I am very thankful to Dr. Weber that you address this issue. There is no perfect model. We are as Mary Poppins, like we want to have the best babysitter for the smallest salary. We want to pay a little bit for great things. We shall look for compromises, and you have to understand what is the most important for your school, how you can solve all these issues. And so right now we are going to close with panel session number 3. We talk about the role of the school medical workers, and thank you our speakers for their work, and they work a lot. And I think that this is just the start of our discussion, and we have also like some materials, and yes, it's really it's kind of heavy books, but take it, and this is just the beginning. And right now we also have 15 minutes, and after that we'll have the general discussion, and each group we have to present our recommendations in this closure session. And we worked hard during these 3 panel sessions, and I would like to start discussion on our recommendations and proposals regarding the school medicine, regarding our approach. Because at our plenary session, we'll have donors, experts, stakeholders, and we need to provide our visions and our recommendation, what we can use and recommend for further development of this topic. So right now we'll have 15-minute discussion regarding recommendations. You have only 1 minute, and Irina will moderate it. Colleagues, we prepared some ideas for recommendations, and we are looking for your comments, because we were talking about the education system. We were talking about how the health promotion reflected in our school policies, and in a recommendation We would like also to include, but it also is included in the strategy of new school, like to make health promotion. And secondly, we were talking about very clear mechanisms for interaction, but interaction not a general understanding, but we're talking about cooperation or interaction just to look at the levels, who is responsible for what, for how you distribute the budget, how you set up priorities and all other things. At the same at the local level, at the same at the national and the regional level. And this is what we are trying to promote and just to understand how just to involve everybody for this process. Also, the liabilities of the Ministry of Education and Science, and we have a lot of things there, and this is commitments and performance of the National NCD Prevention Plan. These are like three first recommendations. Please give your comment, and maybe you would like to add something. And this is a list of recommendations just to start the conversation, to start this discussion.
Це те, що вже звучало в цій залі, там ми просто намагалися його швиденько підсумувати і вивести, те, що стосується політичного.
So this is kind of the political level of our discussion. Do you have any comments or remarks regarding these recommendations? And we have a problem, and we mentioned this problem, that the subject basics of health can disappear from the educational program, and always the teachers disappear. Yeah, we came and we said you have to be healthy, and this is it. It shall be more clear. Just also like to continue the training, to maintain the training of the teachers who is responsible for the subject basics of health. My own experience when I was at school, it was more than 15 years ago. I just graduated from school. We didn't have the subject as the basics for health, but we had this subject as the basics for medical knowledge. And the school nurse, she was teaching us. And if there is a subject basics of health and there are no teachers, maybe we can involve a nurse, school nurse, for these lessons, or maybe to have some joint topics. This is a proposal. This is from my own experience. And we have the lesson, the course for medical knowledge. In the lesson, the defense of the motherland. But we are talking about this subject at school, the basics of health. It had different names before, and since 2001 in the Ukrainian schools, the curriculum introduced the subject, the basics of health. But in Ukrainian school right now, in the first grade, so this subject, these topics are integrated in different subjects, and we didn't see the state standards for the primary and secondary education, and we don't know right now. We don't have an understanding how this subject will be lectured in this primary school, secondary school. And as for the basics for the medical knowledge, this is a course, a special topic in the lesson, like defense of the motherland. Looking at the current political condition in Ukraine, this is very important right now. Our second recommendation, just to use the tools that we develop just to communicate them in the school, colleges, and educational institutes. I think that we will not have any objections regarding it. The microphone. Okay, I would like to emphasize that we just don't have to apply these developments. It shall be also included to the curriculum. Just shall be preparation for application. Oksana Goril, Lviv. Just my proposal is like to give more authorities to the school nurse as for the first medical aid support of children with chronic pathology, just to authorize this nurse on the legislation level. And of course, the vaccination because it's also very important. There is a certain misunderstanding when talking, like if a sick child is at the school and we say there is special, like the document that is signed by the pediatrician, by the doctor, and so the nurse takes this recommendation of the doctor and just manage the child in taking these medicines. And as for the emergency aid, these the skills that the nurses shall have, and the nurse will be able to provide this first medical aid. But when we're talking about chronic diseases, also the doctor prescribes the medicines for the child that shall be given to the child in the case of emergency. And the nurse just shall make sure that the child receives this medicine. Not to have understanding. In the textbook, you see these forms that are not approved, confirmed. This is our proposal from the project. And right now we have situations when parents, they do not disclose the information about the child's health condition. And at school, nobody is ready to respond to the emergency condition. We looked at American experience, and like in the country when they have all these documents regarding confidentiality, then there's like court system works that really protect the rights. And nevertheless, in the US, they use this form as the roadmap. When a child comes to school, and the teachers, the nurse shall know about the medicines that are prescribed for this child by the doctor and what shall she do in the case of emergency or in the case of expiration. We are not we cannot just approve the nurses to develop the treatment. The nurses shall not develop the treatment. So, and we just have to understand that. And this is the answer to how school is going to solve it. And if it's difficult for us to work like that, please give us this roadmap for the children with chronic diseases. And just coming back to whole of school approach for NCD prevention, we are talking about the model of a health school. Health school can be recommended, can be promoted with the help of the Ministry of Education. And the second, this is a development of the policies we can approach the school workers. So everybody who works at school, they can take part in this process and just to take part in developing of the school health policies. So let's add our list.
Ну,
No microphone.
ну, можливо, але
Oh, maybe, but you should agree that where there are regulatory documents, it is not always complied with. So I believe that you need to take all the paths and promote that as a good, relevant instrument. And another aspect, it is preparing for accreditation.
принцип прийняти. Так,
And for that sake, the School Health Index as an instrument, mobilization of resources to improve the environment, the condition, because we mentioned as one of the outcomes where educational facilities analyze themselves and consider the priorities, use that as an argument to look for resources, where communities, local administrations, if they are engaged in the process of decision making, if they own this idea, then it significantly improves our chances to look for resources, to find the resources to implement the changes as soon as possible. And a lot has been done to implement the trainings based on advanced training curricula and facilities, and within the facilities, where that work is part of the working plan to train the staff. But would it be that obvious that that's going to be a tool to be used? Just a tool? Okay, other colleagues, let us expand the list of our recommendations. Okay, and the role of the health professional. This is to include the modern competences for health professionals at schools, at educational facilities in the list of competences. We want the competences that are recommended by WHO to be included, to be reflected in the curricula. We thus will be then in the position of training the professionals, increasing and enhancing the status of a school nurse. This is what we discussed actually. This is about regulatory provisions and also about the salary, about prestige of the profession, access to advanced training, and integration of the school health service into the model of healthy schools, where the nurse is a full-fledged participant, is engaged into policy making, and she comes up with the recommendations to improve the facilities, creating the educational space. So really to open it up and to ensure a full-fledged participation and engagement in school approach. Expanding, disseminating experience, best practices from pilot facilities. Rolling out this pilot experience. The healthy school model, this is a modern model that we adopt. We have this interesting practice that I could share with you, and maybe representatives of colleges could hear that. So there, a nurse of an educational facility, if she receives the degree of a bachelor for public health, she becomes a teacher for basics of health, and actually she gets two specialties. This is the teacher for basics of health and the nurse or physical rehabilitologist. I attend different educational facilities and I don't see enough awareness there that it's not only for at medical school that they can get the specialties. Well, the nurse needs a degree of a bachelor. Well, actually, the nurse who is a bachelor, she can be recruited and she can teach at an educational facility. Now, even in that case, she cannot teach at school. She needs a master or she needs a specialized degree. Well, actually, the most relevant question is about her salary, and that's the motivation. And for salary, at any budgetary institution, and the manager decides on how to distribute the funding. You always have kind of funds to contribute if you wisely distribute that.
And all these, steps you describe reflect modern competencies, the 5 status, School of Medical Nurse, and ensure the professional, continuous professional education needs something more. I mean, the first step could be comprehensive situation analysis. Because in this way you can, look in more comprehensive way, what do you have, what sources, what current, distribution of nurses, what is the average age? Because we know that, school nurses is like, it's more like an aging cohort of health resources. But I think you need to look more comprehensively what is happening now with education, with equipment, with the paperwork, with requirements, current requirements, because in this way you can make, more like, thoughtful decision about this, terms of reference for school medical nurse and, competencies.
Дякую. Ми це враховуємо.
Thank you, and we do take that into account because one of the recommendations is to have a proper assessment for that, to plan further steps. That's reasonable. So if there are no more comments, pressing comments, we need to wrap up because after 5 minutes we will need to go. No, sorry, after 20 minutes in the central hall, in the main audience, we will have the plenary session, and there we will need to present our recommendations that we have developed. And I believe that if you don't have very dramatic changes to that, actually we worked very fast. It was just 3 hours, so definitely there could be some additions to that. So WHO have already submitted these recommendations, and I believe that we will convey this message to the ministries, the Ministry of Education, the Ministry of Health, and I believe that our discussion will not end there. We have completed a very important phase, actually. For 4 years, we were working, and that was a component that was not seen as significant, as a huge component. That was a minor component to add to the clinical one. But it increased, so expanded so dramatically that I believe that now it is a suction air movement in itself, so to say. So we focus on the concept of the health space, So I believe that we are going to continue moving in that direction. But they always recommended that we need to assess what we've done, and we express gratitude to all those who invested their time, their energy, their inspiration, creativity, their wish to see our children healthy, and also to become younger and healthier themselves, because when you deal with children you also tend to be younger and to perceive life in a different way. That's why we work with children. Then we feel younger, healthier, despite all the stresses, the conflicts of generations, but nevertheless we continue doing that. So let me now express gratitude to you, and let me tell you that we do not stop there. We are going to continue working in that direction. And now, again, we are sincerely grateful to all of you. And even though yesterday WHO was distributing those certificates of appreciation, we do not duplicate that, but we are also very grateful to our educators, to our colleagues, and we have our certificates, our own certificates for you. Dear colleagues, actually that's very nice and sad to some extent, because during these years we've become good friends and we have visited your schools, and we are so happy to witness your success, and we hope that we have also contributed to that. So, to appreciate our collaboration and hoping for further collaboration, let us express gratitude for this years of work.
Кочерга Оксана Наталія Миколаївна Роч. Козак Ірина Олексіївна. Самий спортивний чоловік на світі Гусев Володимир. Рівні Олені Яківні. Преслівській Ірині. Михайловій Ірині Володимирівні. Михайлова Ірина Володимирівна. Дякую.
Подяк насправді більше. Є наші колеги, які сьогодні не приїхали, але швидко зачитаємо.
Гребенюк Тетяна. Олена Борисівна. Білоконь Ірина Петрівна. Добранський. Мельников Михайло Борисович. Решівський Тетяні Петрівні. Раку Наталії Іванівні. Медведюк Галині Юрівні. Гулій Анні Вікторовні. Будь ласка. Костенко Ольгі Віталіївні. Страшко Інні Васильівні. Мельнику Віктору Івановичу. Пилибаюк Світлані Іванівні. Гурван Олені Петрівні. Горіній Оксані Йосипівні. Михайлівні, Дудко Людмилі Миколаївні, Луценко Людмилі Вікторівні, нас так багато, Харченко Вікторії Миколаївні, Савчук Ларисі Володимирівні, Василик Ірині Анатоліївні. Те, що не своє, вертайте назад.
Це подяки нашим школам, всі наші колеги, експерти із медичних коледжів.
Зараз мені щось буду казати.
І окремо ми не писали листи подяки, але в нас є дуже серйозні наші партнери.
На мікрофон.
Тому що вони були віддячені. Вчора я чула пані Катерині Вос готував так всі ці подяки. Я хочу сказати про те, що я безмежно вдячна нашим експертам.
So I'm very grateful to our experts, and we engaged a lot of experts into the project, and you've seen many of them today. But I'm very grateful to the Ministry of Education and Science, and personally to Svetlana Fisaila. Thank you for your very important contribution, investing time and efforts. Thank you for being a volunteer there. I'm grateful to Katerina Balabanova. We worked with her for actually a year, and there were problems. We overcame those problems. So we didn't have problems between us now. Those were external problems, sure. And I'm very grateful to our expert who has incredible experience. This is Professor Strashko. This is a person who actually continues moving and working in that direction. Thanks to those who worked and who represented the Foundation for Women's Health and Family Planning. This is in particular Ms. Irina Skorbun. You saw her in the field. You saw her how she works as a monitor. She is an analyst, she works with documents, and any mistake kills her. So sure, the documents are high level, high quality. I'm grateful to Angela. She provided us with all with support for all the activities. There was no discomfort. Everything was on time. Then Anya, who worked with us, very creative. She worked on the internet, the communication, the health space school. She worked she was so professional. And another colleague is not with us. This is Andrei Solovyov. He is now attending kindergarten. There is some event there. So all the design, poster design, it is Andrei's. He was very professional. Katya Kirichenko, another designer who participated in designing the materials. So I'm so happy that we had that collaboration, and I'm very I was happy to work with two more people. This is Martin, who invested his knowledge and who has always been with us. And we had the great medical team. These were representatives of the Institute of Pediatrics and Gynecology, Irina Matviyenko. This was done by her team. Then our important new partners, this is Lesia Vovk. And I'm sure that we will continue this important training for school nurses. We will see how we will refer to them, public health nurses or whatever, but we know that they will work at schools. And I'm very grateful to Oksana Paley. She is a great teacher, a great trainer, and she's with us even though she had some other activities planned or assignments. And Ms. Irina Nazarova, so grateful to you. It is warm in Lviv, despite it rains, but you are warm people, and now we wrap up this session. And I invite you to go to the plenary so that we could wrap up.
That's Galina. And I'm looking, so thank you very much for having moved all this thing over the years. And I'm looking forward to work with you, scaling it up in Ukraine. But I hope I can build on you as well, taking it to other countries in the region and contributing to the Schools for Health in Europe network, because I think you have very valuable experiences to share. Thank you.